Welcome to Taiwan Talks. I'm Betty Chen. Recently, the whole world has been facing a very serious issue, that is the shortage of medical professionals. And people are saying that with the rise of artificial intelligence, perhaps AI can help address this important issue. Joining us today, we are very honored to have invited an expert. Please allow me to introduce Mr. Jack Lee, Taipei Medical University College of Medical Science and Technology, Distinguished Professor. A warm welcome to you, Jack, to our show. Thank you for your time.
Thank you, Betty.
Thank you. So, as I have said, we understand that this is such an important issue. Now the whole world, not just Taiwan, has been facing the serious issue of shortage in medical professionals. What will be the main root cause and how has that impacted the patient's care and also the overall healthcare system?
Well, if you talk about root cause of healthcare professional shortage, it's still economy. Because of the aging society and the new technology, new medicine, new treatment for all kinds of diseases, the whole world has a problem facing the growing healthcare cost. It's probably the only industry that has grown 10% every year for the last 40 years, right? So if you see all the other industry, they're up and downs, but healthcare is always going up. Right, because we live older and older, we demand more quality in healthcare, and there are many new drugs, new treatment, as I said, new technology. So the cost is pressuring the healthcare professionals to lower their salary, extend their working time, and therefore there's a shortage, like globally, on healthcare professionals.
And how has that affected the quality care for the patients and the overall medical healthcare system?
Yeah, it's very serious. In Taiwan, we have a shortage on nurses that actually practically affected the 30% of the beds that cannot be open to patients just because we don't have enough nurses. In terms of doctors, overall we don't have a shortage of doctors, but we do have shortage on some subspecialties, right? For example, pediatricians. We don't have that many pediatricians because of the shortage of new population, the lower population of young kids, and also we don't have that many OB/GYN doctors. But in terms of general physician, numbers of physicians, it's not in shortage right now. But apparently there are more physicians taking interest in other fields. For example, cosmetics, that's one thing, yes. Some physicians just go directly to cosmetics without any subspecialty or specialty training. So that's actually not a good sign for the future.
That's the reality, right?
Right.
We understand that medical professionals are facing huge pressures. For example, as you have mentioned, some doctors, they just left the profession or they directly go into maybe less stressful choices and leaving those behind who are still in the medical field with extra burden, and they face the issue of burnout. So that's why people have been talking about by bringing in artificial intelligence, maybe AI can help address that issue. Could you please tell us a bit more about how AI has been employed or utilized in the field of medicine?
Okay. As you mentioned, burnout, actually when I'm in those international conferences, the most talked about and the most populated conference rooms will be topics related to burnout and then AI. And hopefully everybody's hopeful that AI is going to help in terms of, well, number one, it will be documentation burden. All the healthcare professionals like doctors and nurses, they spend more than 20% of their time typing or creating medical documents so we can put in a medical record, right? It is important, of course, but since we start to computerize everything, they spend more time in typing into data into the computers.
Routine work, right?
Right. So that's 20% of the time that you have to sit down and occupy a computer and cannot see patient, right? It cannot be doing procedures. So their survey saying if we use properly this large language model or generative AI, like ChatGPT. I mean, people have used ChatGPT and they understand if you ask ChatGPT to write a letter, typically it will give you a pretty good letter, right? And a poem or something like that. But you can actually ask ChatGPT to write a admission summary, discharge summary, giving it enough data, it can actually give you a pretty decent discharge summary, which typically take like 20, 30 minutes of physician's time to type it down, right? So potentially it's gonna reduce documentation time by 50%.
Oh, wow.
Yeah, and that's actually, 10% of all the time that they spend in a hospital. So it's actually a very significant and promising future, although it has its own problem of hallucinations, right? Have you heard about hallucination? Because
More about that.
right, because large language model, the way it's trained, sometimes it will tell you things that's not there. For example, in the discharge summary that they created, for example, it's a patient with a heart disease, but the patient came in without a chest pain, with other symptoms, but without chest pain. But in the discharge summary, it says patient came in with chest pain.
That's the hallucination.
That's hallucination.
Right.
Although it's reasonable that patient has heart disease, may have chest pain, but in this particular patient, there's no such thing. But sometimes they're just trying to put it in and make it reasonable, right? So that's a problem. You still need human to verify these reports and documentation. The other thing that AI can help a lot is about patient safety or things that we tend to ignore. For example, if a patient came in involved by a traffic accident, for example, the spleen, the patient got hit by the car, so the spleen ruptured. And we did a computer tomography or CT scan. Most of the time we focus on the abdomen area, right? But then some people, AI can now help you look at other area, for example, the brain, and find out a small hematoma in the brain. Because when it first started, subdural hematoma can be very small, very thin. And when you are all focusing on the abdomen, human or doctors may ignore the hematoma. And after 3 hours, 6 hours, it becomes larger. But AI can scan the whole images and find things that you may ignore. So it improves the safety of the patient, improve the quality of the care. And it also can be a tool like attention focusing. For example, if a patient has many cancer, like all over the place, it will be able to count and actually mark the spot before a radiologist even start to read them. So it will help the radiologist to read these things that's already marked. So AI has been very useful in healthcare images, and hopefully it's going to be helpful in documentations. Eventually, it might also help diagnosis and treatment. Although currently, AI it's not a routine thing that we use AI to help us do diagnosis or do treatment. There was a product from IBM called Watson for Oncology. That was a product that lasted about 10 years. Eventually, they folded. But that product was an AI program that actually provide treatment suggestions for cancer patients in about 12 different cancers. But it will sell for like $1 million per user per year, right? Because it's only for the hospitals. And after like 10 years, they actually stopped selling it because it wasn't very successful. The reason being, the AI only got information from the document. They never actually have eyes to see patient, right?
Right, right.
So,
they needed documents, they needed data, right?
So all the data, all the documents were fed, or human will feed them to the AI, and the AI will based on limited data to determine the suggestions. And so most of the time suggestions are not very useful. And also 90% of the patients are not difficult patients, right? You don't really need AI for very routine things. So I think AI, in terms of diagnosis and treatment, they may be useful for rare diseases, for difficult diseases, difficult cases, but not like everyday use or for every patient. For example, I'm a dermatologist. 80% of my patients are just, acne foot, acne. You don't really need the AI to help.
And I'm thinking about the possible bias because depending on the person feeding the data to the AI model. And so far, I think we have more data being fed to AI, maybe from Western society. When it comes to Asian patients, maybe we have different symptoms due to the ethnicity. How are we going to overcome this kind of biases or maybe the errors arising from AI?
That's a very important question, a very legit question. Actually, as a dermatologist, there was a research about all the textbook, all the photos in the textbooks of dermatology. They're more than 95% they're white people.
Right.
So you actually learning white skin dermatology.
What about Asian? What about other people?
Right. Not even black, right?
Right.
Like in the U.S., there are many black people. So if you feed your data with only white skin, what will happen in terms of making suggestions for? But that really is a topic that's been studied quite vigorously right now. In some questions, in some problems, it will be serious biased. Okay, be seriously biased. In some other problem, it's more generic that you can actually learn over the machine learning can actually overcome the skin problem. For example, if we look at a nevus, moles, right? A nevus is like usually a black spot on the skin. So when you train the image of skin with a nevus in the middle, you can actually change the skin color before you train, right? So one image of white skin, black nevus in the middle, you can generate that into 20 different images with different color of skin, and then you feed the machine learning. Then it will be less biased.
But it's up to the person who trains the AI to do so, right?
Right. But it's a general technique that we will spawn one image into like a little bit off focus, a little darker, a little brighter. Even sometimes we change
To give
the
more
background.
varieties.
Right. So the machine will not be over-trained on a specific feature, right? So by changing the background or changing the lighting and sometimes even the angle and perspective, you actually are telling the machine that what is the real point, what are the noises, right? But if you only give training to the machine very clear, very clean images, then it's hard for the machine to tell which is your main feature.
So I'm thinking, I understand that, Jack, you are an expert in Taiwan in terms of helping Taiwan developing the EMR, electronic medical records. You're the expert. And I read from one report, you said that in Taiwan, we have the national health insurance system. We have such large amount of data. However, it has not been fully utilized. And due to the fact that the data is not centralized and it's not in the same format. Any suggestions? What will be your suggestion for Taiwan if we are going to use AI to help us? What can we do?
Okay, so since 1995, which was exactly 30 years ago, all the health insurance, all the health data that we need to claim to the National Health Insurance Bureau are electronically stored. And they're kind of standardized, although not
Just kind of.
it's not international standardized, but it's kind of the NHI will ask you, the National Health Insurance, they will ask you to submit a specific type of data in a specific format. So every hospital will have to follow it, or you don't get the money, right? It's that easy. So we kind of have a centralized, uniformed data repository of healthcare data, not all the healthcare data, but many of them, much of those healthcare data of 23 million people for 30 years.
That's incredible.
Yes, and we are there are some countries that has a little bit longer, like Denmark probably have 35, 40 years of data, but they don't have 10 million people. They have 6 million people. We have 23 million. So as far as country more than 10 million people, we're probably the most standardized, most centralized, and the longest period of time. And the interesting thing is our national health insurance, we almost pay for everything. We pay for dental plans, right? We pay for children. We even pay for
Talking
Chinese.
about universal coverage,
Yeah,
right?
traditional Chinese medicine, right? We even pay for
Everything.
TCM, right? In most of the country, dental are not covered, and TCM are not covered, things like that. You have to buy extra insurance. But in Taiwan, it's all covered. So the good thing is we have that, and we don't go out of the country to seek healthcare that often. Very, very rarely where you travel to the U.S.
Because
to
in Taiwan, we already have very good quality of
Right.
medical care.
Yeah, the first is very convenient, it's very inexpensive, and the quality is quite good.
It's really good.
So we have this. It's like a large experiment, up 23 million people, right?
For
And
30 years already.
For 30 years.
And it's ongoing.
So we have the largest treasure in terms of data-driven AI. If we utilize this data fully, we're able to actually predict the 23 million people and their trajectory of the healthcare needs, diseases, right? How to get healthier, live longer, right? So I think the problem is because of privacy issue and other issues.
Maybe legal restraints.
Right. There are some group of people saying, my data is there and I don't want my data to be, although it's de-identified, there are still people saying, even de-identified, I don't want to volunteer my data, okay? So there's still argument, but if we can fully utilize data, that kind of data, it's really quite unique, one of a kind in the world.
It can
and
be
it's
very,
valuable.
very powerful.
Yes, yes.
Right. Talking about the medical healthcare situation in Taiwan, we understand that training young people is also a very important part. How do you see Taiwan or the world in terms of incorporating artificial intelligence in their education and curriculum?
Right. One interesting anecdote is that when Nobel Prize winner this year called Geoff Hinton, okay, Professor Geoff Hinton from the University of Toronto, he predicted, well, actually years ago, he was the one who invented an algorithm called CNN, or not the CNN,
Not a television
not the
station.
cable news. Yeah, it's the convoluted neural network. CNN actually kind of revolutionized the accuracy of AI recognizing images. Okay, so he predicted like years ago, and he's still saying it. He said, I don't see why we need radiologists in the future, because all the medical images can be just recognized by AI.
But definitely radiologists don't want to hear that.
And when he said that, the next year, all the radiology department, they cannot get residents. Nobody want to apply. But now it's getting...
That's the words from a Nobel Prize winner, right?
Now it's getting back a little bit.
Okay.
But I mean, radiologists will be kind of the first to go if AI start to replace
Do you
some
think that they can
physicians.
fully replace the human radiologist or maybe just partially?
Okay. Well, a typical human radiologist, they'll do two types of things. One is reading the films, reading the images. The other is called interventional radiology. They also, while having real-time imaging, there's also insert tubes into the blood vessel to treat patient. So these part will still be there.
Okay.
But the just reading the
part.
images is probably gonna be replaced by AI soon enough. Probably 5 years, 10 years, I don't know. It's hard to predict, right? But they will be the first to go. And then probably pathology. They're also reading images. And probably
So anything
dermatology.
related to imaging analysis, maybe they're the ones.
Right. And the third one, probably dermatologist. I don't know. But I will tell young people that you need to understand how to utilize AI in your study, in your education, and in your practice in the future. I really don't care if AI is going to replace all the physicians in the future. If AI is going to replace physicians, we'll just find something else as occupation, right? But some anecdote is that I usually tell people, when you are comfortable getting on an airplane to another country without a pilot, it's all AI, right? And you're willing, you're comfortable to get on an airplane that fly you to the United States or wherever, then probably physician can be replaced by AI. Because it's a lot of liability, right? It requires a huge amount of trust. Okay, but before AI replace all the physicians, AI is going to first contribute to burnout problem, right? Well, in the night, right, you can have AI physician respond first. In the remote area, you can have AI physician respond first, right? So it would be good news for physicians to begin with. Then after probably 20, 30 years, people start to trust AI, and gradually we don't need that many physicians. So most of the physicians will be just telling the patients that they will get better, trying to encourage patients, befriend patients, and make them feel better. But the treatment, diagnosis, reading the images, giving the
Or even
drugs,
parts of the treatment, or even performing the surgeries.
yeah, even the surgeries,
be done by robots.
Yeah, it could be. Yeah. So, but it will not be like in the next 5, 10 years. Robot is a little longer, because as you can see, the robot market, although it's kind of booming right now, but a real humanoid robot that can be in service for simple things like lifting a cup, or do some
Picking up something, right?
yeah, picking something, doing a cocktail for you. That will be in another 3, 5 years, right? A robot doing surgery, I think that will be like more like 15, 20 years.
It might happen, but not that soon.
Right. It will not be happening right now.
Right. Jack, I'd like to go back to what you have just said. You talked about the responsibility or the liability. Now we understand that governments are making laws. Let's say the EV, electric vehicles.
Right.
People are saying that, well, if there's no driver in a car, if an accident happens, who should be held liable? What about AI in medicine? If something happens, who's the one to blame?
Yes, that's a very good analogy, because self-driving car or
Autonomous vehicles.
smart car, autonomous vehicle. If you go to level 5 or even level 4, level 5 means you can totally forget about the wheels, right? You can step into a level 5 car. There's nothing that you can manipulate. You can just sit there,
Right.
and you watch TV or you play cards with people, and then you're
Right.
there, right? That's why all the liability will be on the car company. Same as AI, medical AI. If a medical AI is willing to absorb all the liability, they can actually have another insurance company that's covering, right? They can pay for some premium, and an insurance company will cover. But an AI company, if you want to replace physician, you have to absorb the liability. So it's only feasible when the errors, that is false positive and false negative, when these errors are minimized, right, to a percentage that's controllable, then there will be insurance company that's willing to insure. Then this business model will be liable.
How likely is that to happen? Or in how long, in how many years?
Okay, it might happen in a limited place first. For
Maybe
example,
in a site for some pilot trials.
right, in a city or like in some country that they cannot afford to hire a lot of real physicians, they might be willing to,
You give it a try.
adapt to technologies like this, as long as the cost is lower than the real physicians. I think it will be lower because the marginal cost is much lower. It's like Mercedes-Benz. I heard that in some of the U.S. cities that they allow level 4 driving, so it's law and liability. Law and regulation will have to be determined by the city or the country.
Yes.
Or the state. And liability will have to be part of the business model and the collaboration with the insurance company. Right.
You talk about another important stakeholder, not just the laws, the government, but also insurance companies.
Right.
Think about that. If we look at the medical profession in the next 5 to 10 years, let's not talk about other countries, let's just talk about Taiwan. Do you think that Taiwan is ready to fully embrace AI, or what kind of preparations should we make in this globalized and AI booming era?
I think we should be brave, because we have that big database as our backup, right? Not many countries have that. And we should be brave and embrace the database, embrace the data-driven smart healthcare in the future. But in terms of implementation, I would suggest we can. I would suggest that we can start with the remote area, like islands. We have many islands that we cannot send enough doctors to, right? We have places in a mountainous area. That's on the map. It's not very far away, but it took like 3-4 hours of driving to get there, right? And so why not let them enjoy the AI healthcare benefits first?
And that can be part of the education, right?
Yes, yes. And if they have a problem, we can start with telemedicine, or eventually we can send them down. We can send a helicopter or whatever to get them down to the real physical healthcare, right? So I think it will be a good roadmap if we start to invest. And eventually other people will come and learn, and we can export, the whole model, right? Yeah.
So I would like to go back to what you have said before. The example of Taiwan, though we have such wonderful big data about the patients, about all the population in Taiwan, people still have concern about privacy or about some legal constraint. How can we strike a balance? On the one hand, we can enjoy the benefits that AI can bring to us, but on the other hand, we also want to ensure that we are not violating the ethical issue and we still can protect patients' data and personal information. How to strike a balance?
Yeah, it's a very complex issue. One simple answer is to provide an option to opt out. Okay, opt out means you feel like your medical data involves so much privacy, and it can be pinpointed to you even if it's de-identified in the future. For example, young girl with abortion history, right? People with psychiatric mental diseases, they don't want people to even doubt that it's you, right?
Right.
You can opt out, meaning you can say, I don't want to be in the record. But I imagine, most countries who try opt out, you only got 1% or less than 1% people actually opt out, right? So like, but if you say opt in, means only people who agree can be put into the database, then you got 3 or 4% opt in, right? That's bad. So I would suggest that in Taiwan we can have an opt out mechanism that people who don't want to be in the database can be deleted, even if it's de-identified. You can be removed totally from the database.
So it's a way to show that actually their opinions are respected.
Right.
And they have the
exactly,
choice.
exactly. The only data that's not very controversial are people who's already passed away. So we are now actively, Taiwan is now actively building the people who passed away, and they're archiving their medical record data for research purpose and other purpose, because these are not and actually you have an end of life data, meaning you know how it begins and how it ends, right? So that's kind of a closure of a complete lifetime data. We can start with that because since 1995, there are quite a few people who already passed away. So in the past 30 years, so I think we have like tens of thousands of them that we can start with.
So my final question, what will be the future for Taiwan's AI application in the medical field? Any final suggestions?
Well, still, I want to focus more on the patient safety issue because of this pressure from healthcare economy, as I said. We are now service more of our time to see more patients under fewer pay, under lower pay, right? So people are tired, burned out, and there will be more mistakes, right? Actually, under the cards of burnout, when you flip over, it's actually errors, mistakes, and the patient's gonna pay for it. With the price of their health or their lives.
Even their lives.
Right, so that's really bad. So we want to make healthcare more affordable and more efficient, but we don't want to make more mistakes, right? So I think AI can really shine in these area that prevent wrong drugs, wrong surgery, wrong diagnosis, wrong treatment, right? So if we can prevent all this, I think that will be eventually that'll be a good market for the rest of the country in the world.
And export our model to the world.
Exactly. Nobody wants to, you go to a hospital to get care, to get better, and then you're wronged, and then you get
Nobody wants that.
right,
Right.
right, injured. That's crazy. Yeah.
Thank you so much, Jack. That's all the time we have, and thank you very much for your insights. If you like our show, please click search for us on YouTube, and also you can subscribe to our website. Thank you, and see you next time. Stay safe.